All right, let's dive in. Today, we're talking about a tiny, tiny piece of technology that's fixing one of the biggest problems in modern medicine. And it all starts with a simple question. So, picture this. Scientists pour years, I mean millions and millions of dollars, into creating a brand new drug molecule. It's a total breakthrough. But then, when a patient actually takes it, almost nothing happens. So why? How can a powerful drug just not work? Well, the answer comes down to a really basic chemistry clash. Here it is, the problem in a nutshell. A lot of our most advanced drugs are what we call hydrophobic. Basically, they're oil-loving, and they just do not dissolve in water. The problem? Our bodies are mostly water. It's that classic oil and vinegar situation. They refuse to mix. And this simple mismatch can make a brilliant drug almost completely useless. And this gets us to a massive challenge in medicine, a concept called bioavailability. Bioavailability is everything. It's not about how much of a drug you take. It's about how much of that drug actually gets into your bloodstream to go do its job. If a drug is oil-loving and your body is water-based, it just doesn't get absorbed right, and you end up with super low bioavailability. A drug with low bioavailability is kind of like sending a super important letter that just never arrives. So how in the world do you solve this oil and water problem? Well, it turns out the answer is an incredibly elegant little solution called a microemulsion. And this isn't just mixing stuff together, this is a really sophisticated delivery system. Okay, so a microemulsion is this special blend where oil and water can mix, all thanks to a third molecule called a surfactant. The best way to think about a surfactant is as a little peacemaker. See, one end of it loves water, and the other end loves oil. So it literally grabs onto both of them and forces them to get along in this perfectly stable, totally clear mixture. And to really see what makes them so special, just compare them to a regular emulsion, like salad dressing. Salad dressing is cloudy. It separates out if you let it sit for a minute, and you have to shake it like crazy to get it to mix. Microemulsions, they're the complete opposite. They're crystal clear, they're perfectly stable, they never separate, and they form all by themselves, spontaneously. It's a total game changer. And the reason they're so special is their size. We are talking about droplets that are unbelievably tiny, somewhere between 20 and 200 nanometers. To put that in perspective for you, a single human hair is about 80,000 nanometers wide. Yeah, these droplets are so small they can actually interact with our body on a cellular level. So this is great, but how do we get this amazing tech inside a patient? Well, the cleverest way is to package it into what you might call a smart pill, one that basically activates itself right where we need it most. It's called a SMEDS, a self-microemulsifying drug delivery system. I know, it's a mouthful, but think of it as a just-add-water kit that comes in a capsule. You've got this oil-based formula with the drug and the surfactant inside, and the moment it hits the water in your stomach, it automatically assembles itself into a perfect microemulsion. So let's just walk through it. First, you swallow the capsule. Then, inside your stomach, the outer shell dissolves. The oily stuff inside mixes with your stomach fluid and, boom! It instantly forms all those little nanodroplets, creating the microemulsion. The drug is now tucked safely inside these tiny droplets, ready to be easily and consistently absorbed right into your bloodstream. And listen, this is not just some theory. This is already happening. It's in our pharmacies. A great example is the immunosuppressant drug cyclosporine. The advanced version, called Nerol, uses this exact SMEDS technology to make sure that transplant patients get a consistent, reliable dose every single time. It has dramatically improved how well that drug works. But a technology this good is way too versatile to just be stuck in pills, and researchers are applying it all over the place in medicine. I mean, we're seeing it in skin creams that help drugs get through the skin barrier way more effectively. It's being used in eye drops to get medicine where it needs to go, in nasal sprays for super fast absorption, and even in injections to safely give drugs that would otherwise be impossible to dissolve. But maybe the most exciting frontier for microemulsions, the thing that really gets you thinking, is in targeted drug delivery, and specifically, using them as a kind of Trojan horse to sneak chemotherapy right inside cancer cells. This is really the holy grail of cancer therapy. I mean, what if you could deliver a lethal dose of medicine only to the cancer cells and just leave the healthy ones completely untouched? That could eliminate so many of the awful side effects of chemo. And that is exactly what this research is aiming to do. The strategy is just so clever. So, researchers design a microemulsion that looks just like LDL, the bad cholesterol, which it turns out rapidly growing cancer cells are hungry for. They consume tons of it. So once it's in the bloodstream, this microemulsion puts on a little disguise, a protein that acts like a key. The cancer cells, with their greedy receptors, see this key, mistake the whole thing for food, and pull it inside. And once it's inside, the Trojan horse opens up, releasing the chemo and destroying the cell from within. Genius.
So it all brings us back to this thought. We're always so focused on finding the next new drug, the next new weapon to fight disease. But this technology really shows us that the next massive breakthrough might not be a new drug at all, but just a much, much smarter way to deliver the amazing drugs we already have. Pretty incredible to think about. Thanks for digging into this with us.